Benefits of and considerations for digital care plans in mental health nursing. A presentation for the Return to Nursing Practice course, January 2025. When I first trained as a nurse, care plans were handwritten, so accessing and updating them with a computer has been a new and novel experience. That said, over the subsequent 25 years, I've worked in digital development, user experience, and user research, all of which have informed the first, second, and third objectives of this assignment, namely to critically discuss or analyse an enhancement to patient-centred care, factors that have influenced this change, and benefits and risks. From having worked on government digital services, as I have looked at digital care plans, I have kept in mind the GDS mantra of users succeeding first time. Whilst appreciating that the resources required to achieve such high levels of usability and accessibility are likely beyond commercial software providers, I feel a comparator is nevertheless useful, and just as members of the public need to renew their car tax online with no previous experience, so healthcare professionals working in busy clinical environments without much time, training or support similarly have a task to do. Index of slides. The presentation approaches its subject from a number of different perspectives, including a model of organisational change management, accessibility and usability, benefits, the user experience, and the impact of machine learning and AI. With an eye to the influences on the wider ecosystem, I've also looked at NHS digital and generic standards for usability, and for the third learning objective of critically analysing change and innovation in contemporary healthcare practice for physical, emotional, and societal well-being, I've speculated upon the impact of AI-generated care plans, something which will inevitably present both new opportunities and challenges. The features of the three most widely deployed care management systems in the UK, one of which I've used, include multiple care plans, and I also considered the benefits and practicalities of these. Slide 1, Overview and Scope. The first paragraph outlines the situation here in the UK, with the leading players and the work that's been done to date. The government's plan for digital health and social care presents a timescale for implementation of here's a quote, all integrated care systems, ICSs, and their NHS trusts are aiming to have core digital capabilities, including electronic health records, in place by March 2025. And that's from a Government UK Communique publication, publication of the Plan for Digital Health and Social Care. Public Health England also the third priority of Public Health England is to be data-driven and to take a digital-first approach. Slide 2, relating the Prosky-Adcar model of change management to the implementation of digital care plans. So I've chosen to look at care planning software through the lens of patient-centred care and the Prosky-Adcar model of change management. That sets the individual's awareness, desire, knowledge, ability and reinforcement as key to the successful implementation of organisational change, that is to say, the introduction of digital care records. It seems relevant for inclusive care planning, where the patient's involvement is a crucial factor in achieving positive outcomes. There's no stopping digitisation, and it offers many potential benefits compared to written notes. For example, instant communication of care pathways and interventions, data-driven insights, streamlined and connected administration, and greater patient involvement. From researching this presentation, I believe that in order to realise these benefits, adopting a person-centred approach to design and development resonates with the ADCAR model here that places the individual at the heart of organisational change. Digital health services are often proprietary offerings and so inconsistent in their adoption of standards. For example, standards around accessibility, interoperability and usability. As the ecosystem matures, it's likely that the NHS will promote standards. However, whilst NHS oversight is well established for medical equipment, I've been unable to determine how web services are regulated in healthcare and the standards that apply. Slide 3. Standards for accessibility and usability. To be useful, care planning software needs to be usable in the clinical environment and facilitate care tasks. There are international standards for usability, such as WCAG 2.2, which is the online benchmark for NHS Digital and GovUK, and indeed many others. The ISO standard is a mark of quality in mainly in production, and there are also informal but widely recognised heuristics around digital best practice, such as those promoted by the Nielsen-Norman Group, heuristics being rules of thumb. Though these standards are widely endorsed and adopted, they are not legislated for third-party offerings. And according to the providers of Care Notes, the third most deployed software in the UK, and a review of their literature didn't confirm whether it was compliant with any of these standards or not. Hopefully, as the market matures, NHS Digital and NICE will drive standards and regulate third-party service offerings. A further complication is the need to ensure data security, which is primarily regulated by UK GDPR, that's the Global Data Protection Regulations, but which may not be secure enough to cover personal health data. 4. Digital care plans, enhancing patient-centred care. This slide introduces the work of Adams and Grida, who've published extensively on the subject and whose book, Treatment Planning for Patient-Centred Care, though 10 years old, still seems quite relevant. It argues that though patient-centeredness is a fuzzy concept, there is a marked difference between a service user being referred through a series of health and social care organisations and administrations, and a user-centred approach that places the patient and their care plan as the centre of a collaborative care network. The book goes on to argue how such a orientation is particularly relevant for recovery from mental ill health. 5. Advertised features of care planning software. These feature benefits are taken from the websites of the 3 most popular UK vendors of care planning software. It's interesting to review and compare how the advertised features appeal to the organisation, care provider, and patient, the latter of which are underlined here. Connecting to the wider health and social care ecosystems seems important for realising the benefits of EHR systems. Only System C specifically advertises to this horizontal integration. From their website, quote, "For example, our Care Flow EPR users can reach beyond the hospital setting with single-click access to information stored about patients brought together by external health and care providers, such as a shared care record system." 6. Digital care plans. Key challenges. Arguably, the technology should be usable, useful, and accessible, readily communicate short, medium, and long-term objectives, deliver comprehensive information without obscuring priorities, and facilitate and optimize administration and accountability. There are some quotes here from the literature. This one from Cutney Lee, 2021. EHR usability may be more important to nurse job and patient outcomes than comprehensive EHR adoption. From Coulter et al., 2015, mental health nurses need to re-establish their therapeutic availability to maximize consumer experiences and outcomes. And for Johnson et al. From 2022, nurses spent 32% of their time of indirect care, 52% in indirect care, and 17% in service-related activities. That was after a fairly large study in the United States and Canada. 7. Multiple care plans. Example of a user interface. This is a screenshot of the Care Notes interface. On my unit, once logged in and the application's opened, the screen of an individual's care plan typically takes 45 seconds to load. Older technology and slow hardware can be major barriers to usability and efficiency on the ward. This screen shows 14 care plans for one patient, which multiplied by just a few patients represents a very large amount of information that the nurse need to be familiar with. They are categorized into BIS care plan and attachment care plan, which are headings that aren't obviously meaningful, and it can be hard to discern priorities and find specific information. An alternative categorization might be to see top-level headings, e.g. physical, behavioural, assessment, discharge, etc., under which additional, more specific care plans might be nested. That is to say, there's scope to improve the information architecture and the navigation. 8. Considerations for care planning software. There are 4 bullet points and 2 quotes here making the case for things to consider. Multiple specialist care plans are useful for defining specific procedures or responses, for example, the treatment of a leg ulcer or responding to challenging behaviour. However, as the last slide showed, it can be hard to ascertain what the priorities are amongst multiple care plans. In care notes, the only categorization seems to be BIS care plan and attachment care plan, neither of which are particularly meaningful. Without regular housekeeping, prioritization, or grouping under holistic headings, numerous care plans can add clutter and obscure what the priorities are, especially as needs change. Grouping care plans under meaningful headings, for example, physical health, short-term interventions, discharge support, might aid navigation and also make it easier to find historical information. The second quote here from Government UK suggests an overarching care plan is needed to promote communication amongst the care network, which doesn't look to be supported in care notes. This might be facilitated by having meta-information that helped to connect and differentiate such things as priorities, short-term and long-term goals. 9. Challenges with implementing care planning software. 3 bullet points. As primary users, nurses need to be on board with and motivated to use digital tools. Awareness and motivation will be helped by these tools facilitating nursing as well as administrative tasks. Software should be usable, require a minimum of additional knowledge and training, and support existing ways of working. That is to say, it should be intuitive and focus on the needs of the end user. With the qualities identified by Prosky-Adcar's model in mind, namely awareness, design, knowledge, ability, and reinforcement, this slide suggests some potential risks with achieving them. Whilst maintaining good records is an increasingly important task, as with any technology, the value proposition for the end user is crucial for adoption. In healthcare, this value might come by better facilitating the patient's recovery, maximising time available for therapeutic interventions, and the efficacy of those interventions. Though nurses don't necessarily procure software, providing and promoting its benefits to them, alongside those for the organisation and administration, might prove an effective implementation strategy. 10. AI-generated care plans, a personal perspective. Given the increase in remote internet-connected sensors and accessible personal health and social care data, it's likely that AI will increasingly be involved in planning, managing, monitoring, and evaluating care. Though this should result in more personalised care and care plans informed by the most effective interventions and available care pathways, it may also challenge opportunities for collaboration between parents and staff. This may be mitigated by the design of these systems according with standards for usability and accessibility and coming from a person-centred approach to development. So moving toward digital care that sees decisions and interactions made by algorithms informed by wearables may well improve care goals and, as I say, the efficacy of treatments. The treatments will be monitored and analysed in real time. However, whether they promote healthy relationships and mental well-being remains to be seen. Computer systems aren't known for being empathetic or supportive, but AI might well change that, along with the management of resources. A personal view is that AI is revolutionising customer support chatbots and becoming an invaluable research assistant, So the benefits are definitely there. AI has the potential to deliver ongoing support and counselling 24/7 and for very little overhead and cost. In fact, engaging with AI tools generates training data which increasingly has a value.